A brain stroke is a serious medical condition that requires immediate attention. It is one of the leading causes of death and disability worldwide. Understanding the mechanisms behind a stroke can help in recognizing the symptoms early and seeking prompt medical care. It happens when blood flow to the brain is interrupted, either by a blockage or a rupture in a blood vessel. This disruption prevents essential oxygen and nutrients from reaching brain cells, which can lead to severe consequences. This interruption starves brain cells of oxygen and nutrients, causing them to malfunction. Brain cells are highly sensitive to changes in their environment, and even a brief period without oxygen can result in irreversible damage. Without these essential elements, brain cells begin to die rapidly. The longer the brain is deprived of oxygen, the more extensive the damage. This is why time is of the essence when dealing with a stroke. There are two main types of strokes: ischemic and hemorrhagic. Ischemic strokes, which are more common, occur when a blood clot blocks a vessel in the brain. Hemorrhagic strokes, on the other hand, happen when a blood vessel ruptures, causing bleeding in or around the brain. Ischemic strokes are caused by a blockage in a blood vessel supplying the brain. This blockage can be due to a blood clot that forms in the brain or travels from another part of the body. Hemorrhagic strokes occur when a blood vessel in the brain ruptures. This rupture can be caused by conditions such as high blood pressure, aneurysms, or head injuries, leading to bleeding in the brain. Immediate treatment is crucial for stroke victims. The faster medical intervention is provided, the better the chances of minimizing brain damage and improving recovery outcomes. The phrase "time is brain" underscores the urgency. Every minute counts when it comes to treating a stroke, as millions of brain cells can die each minute without proper blood flow. The sooner treatment begins, the less damage occurs in the brain. Rapid response and timely medical care can significantly improve the chances of survival and reduce the risk of long-term disability. When a stroke patient arrives at the hospital, doctors work quickly. Time is of the essence because the longer the brain is deprived of blood flow, the more damage occurs. Every second counts, and the medical team is trained to act swiftly and efficiently. They need to determine the type of stroke and administer appropriate treatment. This involves quickly performing diagnostic tests, such as a CT scan or MRI, to understand whether the stroke is ischemic or hemorrhagic. The type of stroke dictates the treatment approach. For ischemic strokes, the goal is to restore blood flow as quickly as possible. Ischemic strokes, which are caused by a blockage in an artery, are the most common type of stroke. Restoring blood flow can minimize brain damage and improve the chances of recovery. One common treatment is thrombolysis. This involves administering medication to dissolve the clot that is blocking the blood flow to the brain. The sooner this treatment is given, the better the outcome for the patient. This involves administering a clot-busting medication, such as alteplase. Alteplase is a powerful drug that can break down the clot and restore blood flow. It is most effective when given within a few hours of the stroke's onset. This medication dissolves the clot and allows blood to flow again. The restoration of blood flow can significantly reduce the extent of brain damage and improve the patient's chances of recovery. Thrombolysis is most effective when given within a few hours of stroke onset. The window for this treatment is typically up to 4.5 hours, but the sooner it is administered, the better the results. Time is brain, and every minute saved can mean a better outcome. Another treatment is endovascular thrombectomy. This procedure is used for more severe strokes where the clot is too large to be dissolved by medication alone. It involves physically removing the clot from the artery. This procedure involves inserting a catheter into an artery, usually in the groin. The catheter is then carefully navigated through the blood vessels up to the brain, where the clot is located. The catheter is guided to the brain, where it removes the clot. Specialized tools at the tip of the catheter can grab and extract the clot, restoring blood flow to the affected area of the brain. This treatment can be effective even several hours after a stroke. Endovascular thrombectomy can be performed up to 24 hours after stroke onset in some cases, providing a critical option for patients who arrive at the hospital later. Both treatments aim to restore blood flow and minimize brain damage, offering hope for recovery. After a stroke, the journey to recovery begins. Rehabilitation plays a crucial role in this process. Therapies focus on helping patients regain lost skills and adapt to their new challenges. Physical therapy focuses on improving motor skills, balance, and coordination. Patients engage in exercises to strengthen muscles and improve mobility. Therapists help patients relearn how to walk, stand, and perform daily tasks. Occupational therapy focuses on regaining independence in daily activities. Therapists teach patients new ways to dress, eat, bathe, and cook. They also help patients adapt their homes and workplaces to accommodate their needs. Scientists are constantly researching new and innovative treatments for stroke. Their dedication and relentless pursuit of knowledge are paving the way for groundbreaking therapies that could revolutionize stroke recovery. These advancements are not just theoretical. They are being tested and refined in laboratories and clinical trials around the world. These emerging therapies offer hope for improved recovery and enhanced quality of life for stroke survivors. By integrating cutting-edge technology with traditional rehabilitation methods, these new treatments aim to address the diverse needs of patients, helping them regain independence and confidence in their daily lives. Vagus nerve stimulation, or VNS, involves implanting a device that sends electrical impulses to the vagus nerve. This innovative approach leverages the body's natural pathways to promote healing and recovery. The vagus nerve, which extends from the brainstem to the abdomen, plays a crucial role in regulating various bodily functions, including heart rate, digestion, and immune response. This nerve plays a role in brain plasticity, which is the brain's ability to reorganize itself by forming new neural connections. By stimulating the vagus nerve, VNS can enhance the brain's plasticity, making it more receptive to rehabilitation efforts and potentially leading to better outcomes for stroke patients. Studies show that VNS, combined with rehabilitation, can improve motor recovery. Patients who receive VNS therapy often experience significant improvements in their ability to perform everyday tasks, such as walking, dressing, and eating. This combined approach harnesses the power of both technology and human effort to maximize recovery potential. Transcranial magnetic stimulation, or TMS, uses magnetic pulses to stimulate specific areas of the brain. This non-invasive technique targets regions of the brain that are involved in motor control and language processing, offering a promising avenue for enhancing recovery in these critical areas. This non-invasive technique shows promise in improving motor and language skills. Patients undergoing TMS therapy have reported improvements in their ability to move and communicate, which are essential for regaining independence and improving quality of life after a stroke. Virtual reality, or VR technology, creates immersive and engaging environments for rehabilitation. By simulating real-world scenarios, VR allows patients to practice and refine their skills in a safe and controlled setting, which can be particularly beneficial for those who may feel anxious or overwhelmed by traditional therapy methods. Patients can practice real-life tasks in a safe and controlled setting. This innovative approach not only helps patients improve their physical abilities but also boosts their confidence and motivation, making the rehabilitation process more effective and enjoyable. VR makes therapy more enjoyable and motivating. By transforming rehabilitation into an engaging and interactive experience, VR encourages patients to stay committed to their therapy programs, ultimately leading to better outcomes and a higher quality of life. Stroke recovery is an ongoing process that extends far beyond the hospital stay. Long-term support is crucial for both patients and their families. Support groups provide a platform for stroke survivors to connect with others who understand their challenges. Sharing experiences, offering encouragement, and providing emotional support are invaluable aspects of these groups. Family and friends play a vital role in the recovery journey. They provide practical assistance, emotional support, and a sense of normalcy. Open communication and understanding are essential for maintaining strong relationships. Technology is revolutionizing stroke recovery, offering innovative tools and therapies that enhance traditional approaches. From smartphone apps to robotic devices, technology empowers patients and therapists alike. Telerehabilitation allows patients to receive therapy remotely through video conferencing and online platforms. This expands access to care, particularly for those in rural or underserved areas. Wearable sensors and activity trackers monitor patients' progress, providing real-time feedback and motivating them to stay engaged in their recovery. These devices track steps taken, distance covered, and other metrics, allowing therapists to tailor treatment plans. Music therapy has emerged as a powerful tool in stroke rehabilitation, tapping into the brain's innate ability to respond to rhythm and melody. Music can access brain areas that spoken language may not reach, making it particularly effective for patients with communication difficulties. Music therapy can improve motor skills by engaging patients in rhythmic activities like drumming or playing instruments. The repetitive movements help retrain muscle memory and coordination. Music can also stimulate cognitive function, improving memory, attention, and language processing. Listening to familiar songs or learning new melodies can activate neural pathways and enhance cognitive abilities. While stroke presents significant challenges, maintaining a positive outlook is crucial for successful recovery. A positive attitude can influence motivation, resilience, and overall well-being. Focus on small victories and celebrate milestones, no matter how small they may seem. Each step forward, whether it's regaining movement in a finger or speaking a few words, is a testament to the brain's ability to heal. Practice gratitude for the progress made and the support received. Focusing on the positives can shift perspective and foster a sense of hope for the future. Life after stroke is a journey of adaptation, resilience, and rediscovering one's strengths. It's about embracing new possibilities and living life to the fullest, even with the changes brought on by stroke. Engage in activities that bring joy and purpose. Whether it's spending time with loved ones, pursuing hobbies, or connecting with the community, finding meaning and purpose is essential for overall well-being. Embrace a healthy lifestyle through regular exercise, a balanced diet, and stress-reducing activities. Taking care of physical and mental health can optimize recovery and reduce the risk of future strokes.